Good morning, students. Am I audible?
Yes, ma'am.
Okay, fine. Almost all have joined. I just only one or two students are left to join. So, as I told last week also that Friday's class will be for the discussion. So every Thursday or Wednesday, I'll float one topic, or you can also tell me if it is a particular topic on which we want to have a discussion. And Friday, 1 hour, we'll discuss on that topic. So each one of you will speak on that topic, whatever you have read and whatever information you have collected about that topic, right? So yesterday I created an assignment where I told you that we'll talk about the Nipah virus. Since again we are seeing the Nipah virus cases in the Kerala, and one death is being reported and few are suspected people who came in contact with that boy. There was a 12-year-old boy who died due to the Nipah virus, right? So I thought that this is a good topic that we can have a discussion on, because there was a outbreak of this virus in Kerala in 2018 also. So we can discuss about that. What is the virus? How it is transmitted? What is the genome of the virus? To which family it belongs? How it is being identified, diagnosed, and are there yesterday or day before yesterday I read a article in the news about it, maybe Times of India somewhere, where there was people was scared that we are already going through one pandemic and we are not yet ready for another pandemic. So are there any chances that this Nipah virus outbreak can be a pandemic also, right? So or even if it comes in the form of an epidemic also, then also number of people will die, because the mortality rate is very high in this virus. So I'll give the opening remarks, and then one by one I'll ask each one of you to give their whatever you have read about this virus, right? So to start with, this is a virus which belongs to paramyxoviridae family, and it is the genus is Henipavirus, right? So if we talk about the virus, it is a zoonotic virus, means that it can spread between animal and people. So mostly about with this virus, the information which is available is that fruit bats, which are also called flying foxes, they are and the animal reservoir for this particular virus, right? So also it is being found in the pigs also. It has been reported to found in pigs. There are some reports about this virus in pigs also, right? So if we talk about this virus, it causes a lot of illness. Sometimes, yes, the range could be from asymptomatic infection to the acute respiratory illness and fatal encephalitis also. And it causes a lot of diseases in other host pigs, and a lot of losses to the those who are rearing pigs for the meat purposes or other purposes, right? And if we talk about the first case, this was the first was recognized in 1999 during a outbreak. There was a in Malaysia, basically in a pig farm. No new outbreaks since then in Malaysia. Then in Bangladesh also in 2001 there was an outbreak where some cases were found, and in India also the outbreak has taken place in 2018 in Kerala, where number of people were impacted. Number was not very high, maybe 18 deaths was reported and around 20 people were found infected. So yes, when first it was recognized in Malaysia, they found that transmission could be from direct contact either with the sick pigs or their contaminated tissues when it was reported in earlier. But then fruit bats, they say it could be the again a major cause, because these are the reservoir host. They are feeding on the fruits in wherever, whichever part of the country they are being found, and their saliva is being already there in the fruit, and those fruit without washing, if are consumed by the person, there are chances that they will get infected, right? So Nipah virus spread human to human also, who come in contact with the people, their secretions, and again you know uh, most of the cases that occurred, that was the close contact with the patient, people who came direct contact with the people. If we talk about the signs and the symptom, could be acute respiratory infection and fatal encephalitis. So they initially they develop the similar very mild symptoms like virals. You have a fever, headache, or a vomiting and a sore throat. Then it can lead to even the unconsciousness, drowsiness also, and the later stages, acute encephalitis can take place, right? So incubation period, if we talk about, is of this virus 4 to 14 days, but then 45 days can last that long also. So most people who survive this, they can make a full recovery, but then there are certain conditions which they feel the certain symptoms which are still last for a longer time. So diagnosis is like for any other virus, it's ELISA or RT-PCR can be done for the diagnosis. If we talk about the treatment, we don't have any drug or vaccines available. Ribavirin was the only vaccine which was used in the last cases also, but otherwise there is no vaccine. So fruit bats are the natural host of this virus, and many chances are there that the virus get transmitted through the fruit bats also. Prevention, we don't have any vaccine, so we cannot talk much about the prevention. It is just that washing off your fruits very carefully when you consume them, or I mean, once it is being identified in some person, if the other people they have come in contact with those people, they can be tested and they should be isolated, because human to human contact can transmit the virus. So it happened in 2018, and in this year September also one case. Till now there's only one case, one death is reported due to this virus. A few health workers who came in contact with this boy, they were so Kerala, in 2018 also, they act very swiftly. They identified the first case, then they identified all other people who came in contact with that first case or index case when we talk about. So they were able to contain that virus in a very short period of time, and that was the National Center of Disease Control, then World Health Organization, and Indian other health organizations and epidemiological organizations. They worked very hard to go and trace out many other people. During they did a lot of surveys and a lot of interviews with the people who came in contact with those infected people, and how it could have been suspected as transmitted there. So they were able to contain the virus in that particular state only. So this time also, when they found this one case again of this Nipah virus and one death was reported, then all of they came into action, and they are tracing everyone who came in contact with that boy. Those people are being quarantined. Those people are being checked for the symptoms continuously, so that it does not spread further, right? So a lot of precautions are being taken. And when any see what is outbreak, when we call a particular disease outbreak takes place, when see sometimes some pathogens are become endemic. Some viruses also they become endemic. That means they are there in the that particular area, maybe cases 5 to 6 or some few cases always comes. But then if all of a sudden those number of the cases they rises beyond that level, that means last year there were only maximum 5 cases, this time all of a sudden 10 to 15 cases are coming up, so that means a disease outbreak has taken place. Now then we need to work, then epidemiological agencies, public health workers, they come into action, and then they start towards analyzing what could be the cause, what is the pathogen, is the pathogen a new strain of the previously away virus which was available. Because usually what happens, the outbreaks take place due to the new strains or some virus mutations which take place, and could be that a new strain is a more virulent as compared to the previous one. So this happens, so we need to check why this is happening, what kind of a people are infected, um, diagnosis, how we can diagnose virus, then how we can manage the virus, what are the therapeutics available with us, what are the possible treatments which are available, and we should go for those treatments. So this is how we all act when a particular disease outbreak is in a particular country take place, right? So now this is open for discussion, and I'll ask each one of you, please, when you speak, just try to switch on your camera also. So whatever you have read about this virus, at least just speak. And if there's any since we all don't know much about the virus, there is a lot of reports are available about the virus, but still we don't have any vaccine, or we don't have much information which is available on the sequences of this virus. Yes, they are being sequenced, but then still we don't know much about these viruses. So we need a lot of research is still required to be done in this Nipah virus case, right? So yes, Adish Mishra, please switch on your camera and tell everyone what you have read about this virus. You can talk about the Nipah virus, and particularly I'm talking about the Nipah virus outbreak in Kerala because this has happened. So a lot of data and a lot of papers are available on the Nipah virus outbreak in the Kerala which took place. So it could be you can tell about how they proceeded for the containment, how they identified it, what was the cause at that time, identified possible causes for this virus transmission if they were identified. So you can discuss all those things. Yes, Adhish, please go on. Yeah, can you hear me, Adhish Mishra?
Yes, ma'am. Ma'am, just a second. I'm
Oh,
unmuting
yeah.
myself.
Okay, can we move to another then? If Adish is still, I mean,
Am I audible?
yeah, Adish. Yeah, you're audible, Adish. Please switch
Okay.
on your camera
Uh,
also, Adish.
yes, ma'am.
Yes, we can see you, Adish. Yes, now you can speak.
Uh, yes, ma'am. Ma'am, so Nipah virus is predominantly found in Southeast Asia and
Mm-hmm.
near regions of Bangladesh and West
Mm-hmm.
Bengal. It was earlier first found in 2000 and 2006. There are still very few cases during in those regions, but these days we can find cases of Nipah virus in Kerala, like the outbreak which occurred a few years back. Uh, it's predominantly transferred by bats. We can say it's a bat-borne disease, and it transfers usually from through pigs and bats and all the livestock, which is why the outbreak which occurred in Kerala, the rural areas were affected, and the whole villages and towns were sealed off. Uh, Ma'am, as you said, that film virus which showed actually I saw that film, which it
Mm.
actually showed the case study and how they contact traced each and every patient, and
Yes,
uh, ma'am, that only because of contact tracing, we could say that we could minimize the losses during that
yes.
time and also during COVID also. And Dr. G. Arun Kumar, I had the opportunity of meeting him back in
Okay,
ILS. Yes,
okay.
yes, ma'am. He was the one who he was from Manipal Virology department, and when
Mm-hmm.
he first got the news of that there has been an outbreak, he um, traveled from Manipal to Kerala, and he worked with the government there, and he stayed
Mm-hmm.
there, and he uh, he made an action plan for the outbreak, and that from that everybody From there, they started containing
Containing
virus
it.
outbreak.
Yes, yeah, yeah, Adhish, this is very right. See, when we talk about any disease outbreak, it could be epidemic or because epidemic becomes pandemic in a later situation. So containment, you see, if this could have been the case with the Wuhan, that they were able to contain the COVID-19 in their country, so situation दूसरी होती, हम pandemic नहीं face कर रहे होते, because this is the preliminary requirement that we need to be active in the case one only, right? When we get a first case, then there should be alert kind of a situation everywhere, that now this is the situation and we need to stop every kind of a thing. So this is, yes, this is what, and the Kerala is one good example. They set one good example that how efficiently they contained that virus, and that virus did not move out of the state, and otherwise the mortality rate of that virus is very high. People actually die in case of a severe encephalitis,
Yes,
which
ma'am.
cases, yes.
It was a very it has a high lethality than coronavirus, and
Yes,
during
yes.
that time it also led to many social unrest. Like the people were accusing uh, in those areas affected in Kerala were like pretty secluded area. Like in one region you could find mainly predominantly of one religion, then of
Mm,
another religion. So people started
mm.
accusing like
Accusing, yeah.
they started discriminating, like we won't touch
Yeah.
or go near you. Then then officials from Delhi also came down. They started
Mm-hmm.
considering that it might be a weapon of it. They can't rule out it might be a bioweapon,
Bioterrorism, bioweapon, yes.
bioterrorism. So people, uh, Doctor Arun was like, no, this is not a bioweapon, because he had been following Nipah virus for a while.
Mm-hmm.
He has worked on Japanese encephalitis in the UP only, and
Okay.
so he worked with these officials from Delhi, and it took some time, but during that time they eradicated. But
Mm-hmm.
also recently again, a patient, uh, a child I think died again from
Yeah, it's
Nipah
a
virus.
12-year-old child and he died due to this
Definitely.
virus.
Yes.
So again, they have contained those people who came in contact with those that children, with child basically, his family, their contact and their contact also. They have contained everyone, quarantined everyone, so that I mean, it does not spread. So after that, no other case is being reported though, but still they are vigilant. They are still checking the. I mean, if there's any possibility of such things to be happening. Okay, Adish, that was good. And okay, we can move to next student. Ayushi, please turn on your camera and speak.
Yes,
Yes,
ma'am.
you're visible, Ayushi, please.
Ma'am, so what I read is that Nipah virus is a single-stranded negative sense RNA, and
Mm-hmm.
like the coronavirus, it is a zoonotic virus, which is that is transmitted from animals to humans. Transmission
Mm-hmm.
is generally occur when humans either come into direct contact with the animals or through consumption of contaminated food. But a high number of human to human transmission cases of Nipah have also been reported.
Mm-hmm.
The family Pteropodidae, which is commonly known as the flying fox, are the natural
Mm-hmm.
carriers of the Nipah virus, and they are known to transmit the virus to other animals, including pigs, dogs, cats, horses, and sheep. So, and in an infected human typically shows symptoms including fever, headache, between
Mm-hmm.
3 to 2 weeks, followed by a cough, sore throat, and respiratory issues. The these conditions later progresses to swelling in the brain cells, leading to drowsiness, confusion, and
Mm-hmm.
coma. There is no cure or vaccine for Nipah yet, and patients are only given supportive medical care. Um, uh, and according to WHO, up to 75% of Nipah infections prove to be fatal.
Mm-hmm.
And the first case of Nipah virus was reported in Malaysia in 1999 during an outbreak among pig farmers. And since then, it have been multiple outbreaks, all of them which were reported in South and Southeast Asia, as what Adish mentioned. And
Mm-hmm.
in the last outbreak in India, which hit Kerala in 2018, it killed almost 17 to 18 people caught it, and those
Mm.
infections were all traced back to fruit bats found dead in the water of a family's well. And it is considered less contagious than the coronavirus, but it has much higher mortality rate. Uh, it has a longer incubation period of up to 45 days, and
Okay,
the
fine, fine, fine. That's all, Ayushi. Good. Yes, you told that it is one point which is more that yes, the transmission rate is less than coronavirus, but the fatality rate is more than coronavirus. That it is more fatal, and most of the people who contacted this virus, they actually died. Only few recoveries were being reported. Right? Okay, Ayushi. Thank you so much. Yes, can we move on to Sam, please? Sam, switch on your camera.
Audible?
Yeah, Sam, you're audible.
Ma'am, so I think everybody almost, I mean, you also said basically everything. So I'll just add the stuff which was not mentioned yet.
Mm-hmm.
So, so obviously we know that Nipah virus killed around 17 of the 19 infected patients. So it has a high mortality rate of 90% in 2018. But as Ayushi said, the transmission rate is less. It's like less than 1% per infection. So the person who are most likely to get infected are the patient, the healthcare workers who are working around the patients. Uh, then the vectors, which are, as you said, the fruit bat and pigs, and it's because that both fruit bats and pigs and humans also have ephrin B2 receptors and ephrin B3 receptors, which are in the neural system, and these are the entry mechanism of uh, uh, Nipah virus in humans. So, like, there's this Australian person who made this antibody, and it's basically a passive immunization, and it hasn't been tested on humans yet, but it was given in 2018 to India in Kerala for Kerala. And there's also another treatment, not treatment, but prevention method, which is a vector-based vaccination, which is currently being tested on animals. That so it's basically if we prevent it in bats and pigs, so we are basically eliminating the vector-based transmission.
Yes, Sam, you said it right that we don't have as such any treatment available, and we are still looking for the treatment because vaccination is not vaccine has not been developed for this. See, vaccination usually we develop we go for when viruses they become very pandemic or they is in some epidemic form. But since this virus, the outbreaks are being reported in some of the Asian countries, but that the numbers were not very high, so not much has been done. And yes, only those people who come in direct contact with the patient and they spend a lot of time with the patient are the people who there are chances that they will get infected. So transmission rate is not as we talk about in coronavirus, that it is not very high. So yes, that is one plus point here. But then once those people are affected, people who are coming in, healthcare people, then they need to be very careful. They need to wear all the PPE kit. They need to be very careful when they are treating. And usually what happens that when first case come, nobody knows that this is a Nipah virus, right? So everybody treat that case as a normal, normal, could be a normal viral infection or normal thing until a diagnosis report comes. So after then only they start taking some precautions. So, but before that, many people are already in direct contact with that virus already. So that is the reason that it has infected some of the people at least who were in direct contact. So that was one reason in case of the Kerala virus also, because earlier they did not knew it. The first patient went to the first hospital, then it was that patient was referred to the another hospital for some kind of a scan also. So until they knew that it is a Nipah virus, it was already in contact with many people, right? So that was the reason that it was it affected few people there. Okay, Sam, that's right, and that's good. Can we go to the Ishita Arora now? Ishita, please switch on your camera and speak. I can't hear you, Ishita. Is your okay? Janvi, can we move on to you then by the time she's ready?
Yes, ma'am. Am I visible and audible?
Yeah, you're both visible and audible. Please speak.
So I just wanted to add about the signs and symptoms. What I've studied is that
Ishita, please later now. I've asked Janvi to speak.
okay.
Yes.
So as Aishi has already mentioned that this the incubation period for this disease could be up to 45 days. But I also want to add that those who have survived with this severe acute encephalitis, they might be fully recovered, but there were some cases where neurological disorders were seen. Uh, I think there were 20% of the patients who were left with these neurological disorders, and it could be seizure disorder or personality changes. Um, and yeah, as everyone else.
Okay, Janvi, it's fine. Yes, since this virus cause a hemorrhagic fever also, so that means it impact the brain also at some point and could lead to certain coma-like situations also in some patients in the later stages. If does see the symptoms are to form. The earlier symptoms are very mild symptoms like a viral fever, we have a headaches and all those things. But the severe symptoms they affect the respiratory tract also, and they can be a hemorrhagic fever that can impact the brain or that can cause a brain encephalitis also, right? That is the major symptoms that is also. Okay, fine, Janvi. Yes, Ishita, can you speak now?
Am I audible?
Yeah, you're audible, Ishita.
Yes, ma'am. Ma'am, Nipah virus. It is one of the virus which was spread due to the due to the bats and the pigs. This virus in India, it was, as you already told, that it was reported in Kerala first. This was very much harmful virus, as due to this the mortality rate was very high. It was a zoonotic virus, and it usually transfers from animals to humans. Ma'am, it can also be transmitted through the infectious food or infectious item that the person who is already suffering from has used. Ma'am, in this virus there were different diseases which were they were not diseases. This virus also caused harmful effects on our on different body parts. And ma'am, in this why this was started from Malaysia only, and in this it was due to the pig contaminated tissues by the pigs. In this, the sign there were sign symptoms which were quite similar to the viral disease, like dizziness, doziness, and some neurological signs also. In this virus there was a cycle of from 14 to 45 days, around like from 14 to 45 days the cycle was seen. Symptoms were seen from 14 to 45 days, and the cycle begins from 4 to 14 days. Different and it was diagnosed by the test the ELISA test, and the PCR test was used for the diagnosis of this disease, this virus.
Okay, fine, Ishita. Yes, can we have a next student, Manas Vanit?
Yes, ma'am. Am I audible?
Yeah, Manas, you're audible. Yeah, you're visible also.
So, since most people have already covered the basic parts of the virus and also about the case in Kozhikode of the 12-year-old boy. I wanted to talk a little bit about the immune response against the virus, since that hasn't.
Mm-hmm.
So we know that the virus, one of the best, let's say, reservoirs for the virus is in fruit bats, and the reason that the infection is completely asymptomatic in the fruit bats and it doesn't entirely affect them is because of the immune response that the bats have. So these particular bats have a protein called tetrin, and basically tetrin, it has certain antiviral properties which it exhibits, and that ensures that the virus does not kill the bat itself, but at the same time it's not fully effective, as in it can't completely kill the virus either. So because of that, there is a kind of immune balance between the two organisms, between the fruit bat and the virus, and that's why its transmission is easy, but the bat itself doesn't die. Now, if you look at it in the case of humans, let's say, like they had mentioned with the pig farmers, where when you're working with the pigs, let's say a human does contract the virus, then the problem is that the Nipah virus can very easily inhibit the cytokine mediated response in the early stages of infection. Now, at this point we don't even know that the human might be infected with the Nipah virus, because the incubation period is 45 days. So by the time you diagnose itself, it's already progressed to a large amount. So because of that, even if in the later stages of infection, if it doesn't fight back as much, it's not exactly necessary for the virus, because already in the beginning it has inhibited and disturbed the immune response. So that's why it also has a much higher mortality rate as well as compared to, let's say, COVID. But also, not the mortality rate is between 45 to 70%. It's not in the high 90s, because towards the second part or the second phases of the infection, there is not as much immune response inhibition. That's all.
Okay, Manaswini, that was a good piece of information that you shared, that why bats are not actually impacted by the virus itself, though they are the reservoir host of the virus. Yes, you're right about that. And yeah, many times, see, it happens with the many reservoir, because there are pigs also, they are reservoir host of many viruses, and there are other animals which are reservoir host of many viruses, but then they are not impacting so much in those hosts. But when they are transmitted, they cross the boundary, like they become a zoonotic, they transmit from a animal to the humans, then there are chances that these viruses will impact a human more in another way, or they can be impacted in a larger way as compared to than they were present in their own reservoir host. So this happens earlier also, like swine flu. In pigs it is being reported, but it was not that much impacted in the pigs. They were not that higher infection rates were reported, but when human transmissions occurred, then the swine flu was impacted. It bring there was another pandemic in 2009, or before that some year, that in few countries, yes, this swine flu outbreak was being reported, and it was recorded that people, yes, they were not people were not dying due to this, but large number of the people were getting infected due to the swine flu also. Yes, yes. Can we have another next one, Namrita?
Am I audible, ma'am?
Yeah, Namrita, you're audible.
Okay. So, Nipah virus is a single standard negative sense virus belonging to the genus Nipah virus. And Nipah
Mm-hmm.
virus is a zoonotic virus, which means that it can spread from animals to humans, and it can also spread through contaminated food or directly contact with the people. And symptoms of this virus include fever, headache, sore throat, and dizziness. And diagnosis of this virus is ELISA and RT-PCR. And there is no treatment or vaccines available for this virus. And it was first recognized in Malaysia in 1999, and then in Bangladesh in 2001, and then in 2018 it was recognized in India.
Okay, okay, Namrita. Can we have a Nandani now? Nandani. Okay, not Nandini. Nehal?
Ma'am, am I audible?
Yeah, Nehal, you're audible, please.
So, ma'am, Nipah virus was the zoonotic virus that it is transmitted from animals to humans. Um, Hello.
Hello, yeah, you're audible. Please go on.
Yes, ma'am. So it is transmitted from animals to humans. So it is spread through food, fluids, or animal and humans to the direct contact. So the first case that was found was in Malaysia in 1999, and the humans was infected. That they was resulted because of the direct contact with the sick pigs. And earlier in India, the Nipah virus case was found in West Bengal in 2001, and um,
In
the
Siliguri,
outbreak.
right?
Yes, ma'am, in Siliguri, and the outbreak of Nipah virus was because of the consumption of fruits or fruit products, and the symptoms are like fever, headache, um and in severe cases it may lead to coma and mental illness. So lately, the Nipah virus case was found in Kerala. In a 12-year-old boy died because of that. And the feature that have been found in the 12-year boy was the encephalitis and myocarditis. And the people who are in close contact with that 12-year boy was also under the observance of the government.
Yes,
That's it.
okay, Nehal. Yes, they are all quarantined. They are all being under observation. They are checking whether they are developing any kind of symptoms or virus or not. Yes. Yes, can we have a Rupal now?
Ma'am, may I?
Rupal?
Yes, ma'am. Ma'am, am I audible?
Yes, you're audible, Rupal.
Yes, ma'am. Ma'am, so everyone almost said everything. So I will just add few more points to it. That Nipah virus is a biosafety level 4, and
Mm-hmm.
the test and the Nipah virus was confirmed by RT-PCR test, but they took different sample. First is from the plasma, second is from the serum, and third is from the CFS, and also the fruit bat, which is commonly known as the flying fox. They are the natural hosts of the Nipah virus. And Nipah virus not only transmit to humans, they can be also transmit and animals, which include like dog, sheep, horses, and cat. And also the incubation period can last. Period range from 4 to 14 days, but it can also like as long as the 45 days. And the symptoms it include like the fever, the headache, and also the swelling of the brain cells, and that's it now.
Okay, fine. Rupal, fine. Yes, Vivek. Next.
Yes, ma'am. Basically, like everyone has gone over almost the basics of the Nipah virus. I wanted to kind of talk about the specific response the Kerala
Mm-hmm.
government had. Basically, if we look at healthcare, the healthcare system in India in general, Kerala is one of those states known for uh, which is known for quite impressive health standards in terms of their healthcare, and that too at very modest incomes. Like if we compare Kerala to the rest of the states in India, so even so, according to that, they relied on their strength of the health system to deal with this Nipah virus. But as we've seen, The outbreak response they had, a lot of it was based upon improvisation. uh, when they began to respond to this virus. Kerala, on the Kerala healthcare system, it saw a lot of technical inadequacies, which were mostly related to any healthcare workers who need more training in analyzing the data in field epidemiology. And even though the Kerala government has continued to collaborate with the World Health Organization as well as the Indian government, the uh, basically their data sharing, um, in terms of this outbreak, in terms of this response, it was quite weak. So and because the data sharing was weak, they also missed the opportunity to properly understand this Nipah virus and the characteristics of this virus, and they were not able to make they were not able to properly make emergency driven clinical trials on a timely basis. And because of that, we can see that this outbreak of Nipah virus, it's showing that the Kerala government, the Kerala healthcare system, and not just that, but the rest of the country, there's a high chance that if certain changes are not made, then there's a high chance of another outbreak to happen.
Okay, Vivek, you pointed out some. I kept that to the last. That yes, there were some negligences and there were some things which were not done right. Like for the sequencing of the genomes to know the genome, that how are there any changes or what is exactly it is. What kind of a genome? Are there any mutations from previously reported viruses? That was not done. Also, the WHO also complained that the data was not adequately provided to them about the incidence and about the number of the cases, that not everything was being shared and which they should have done,
Yes,
right?
ma'am.
And
Yes, ma'am.
again now, yeah, they are facing the similar kind of a situation again. I really hope that it doesn't go beyond. Yes, they are public health workers, because at Indian level, it was not done at the Kerala level only, and the Indian epidemiological organizations such as National Center for Disease Control, then the other national organizations like National Institute of Virology, Pune, right? So those people, they come together, they work together. Yes, they were able to contain the virus, but then still, like you told, that people were not workers were not they were not trained enough to handle such patients. They were not given any kind of a training, because when such outbreak happens, we need to inform, they need to guide, and they need to give certain guidelines to the healthcare workers also, that how they should be dealing with such patients. So there
Right.
was definitely certain kind of a lacking in that point also. But then I guess we learn from the mistakes, and I really feel that this time they are able to contain the virus, and this time they are able to manage it in a more efficient way. And I still believe that the scientists across the country, they need to work more on the Nipah virus, because this disease is coming in one. I read one paper also yesterday about this, and there are chances that it will become endemic in a particular part of the country. It could be present there always, and maybe cases, some outbreaks every year could come up, right? So there are chances for that also.
Yes.
So they need to seriously think about this, that how they should move further and how these things should be managed. Okay, so for since most of the things we have discussed about this Nipah virus, we discussed about that how it is transmitted, we discussed about the symptoms, we discussed the diagnosis also. Prevention, there is nothing as such, but there are some things like if how they can be prevented, like vaccines we don't have, but then since it is being transmitted from pig farms or pigs also to the humans, and pigs are being raised or reared um, for the meat. So definitely those farms, they should be clean, they should be disinfection of the pig farms with properly, it should be done. So people who are handling pigs, they should be very careful, right? If there's a such outbreak is suspected, then those premises should be quarantined immediately, and if required, culling of the infected animal, that should be done properly again. So that is the thing. And if we want to reduce the risk of infection in the people, then we need to make people aware. We need to guide people about the risk factor, and we need to tell them what they can precautions can be taken. So bat to human transmission, then definitely keeping bats away from the sap collection sites, or a protective covering, some kind of a coverings over the fruit trees can be done. And then gloves and other protective clothing should be worn while handling sick animals. Then if we close unprotected physical contact with Nipah virus infected patients should be avoided. So that is which can be done at our level, that how we can do that. The first thing is the awareness of the people. For the management of any pathogen or any disease, awareness of the people or educating people is very important, because we need to tell them that this is they need to do, these are the guidelines they need to follow, otherwise the consequences will be very impacting, they'll be very bad. So guiding, educating people, educating common people is the first, should be the first priority of the government, that how to inform them, how to make them educate that these are the precautions they are required to take. And then one of the student, they also talked about the social stigma. Yes, since sometimes it happens that the particular community or maybe particular group of the people are more infected by a certain kind of a pathogen. So sort of a social stigma is among the people. These kind of a things, they spread very quickly among the people. They all, because this was in case of HIV patients also, that people were not ready to, like, they'll not touch them, they'll not feed them, they are being disowned if someone in the family is having such disease. Though 1,000 times government told that this is not contracted by the touch, even people were not ready to cremate the people in their own family also, like if they were infected by this disease in the earlier days. But now, with the way the educating programs were given, the way the advertisements were given by the government of India also, like there were a lot of information being provided, and this is not it is being contacted, this is now you'll contract the virus. There are specific ways by which the virus get into the human, so they are being told about that, and people are told the precautionary measures for everything. So then that thing, it becomes a very important, that so that a particular people, if they are affected by a particular pathogen or virus, they are not suffered, they are not left out to die, like, okay, this is being infected, so we are not going to touch him and we are not going to do anything. No. So that kind of attitude of the people is very negative, and we need to change that attitude, because at the end, a person who is suffering, he needs some care, he need a emotional, moral, mental, every kind of a support, apart from the health support. So that support should be there with the patient. So we need to be uh, those people, we need to educate that this will happen, this does not happen, if you think by touching this can happen. So a kind of a proper guidelines, and how to convey those guidelines to the common people. So that point is very important, right? So those students who have discussed today, Manaswini, just send me the, can you just make a list in the mail me or message me or WhatsApp me that these have spoken for today, so that in the next Friday's session we'll start with those people जिनकी आज टर्न नहीं आई है, right? So for next Friday we'll choose another important topic. I'll float that topic maybe by Tuesday only. So those students जिनकी टर्न आज नहीं आई है, they'll speak first on that topic, and then other students those who have spoken today, they'll get to speak on that topic particularly, right? So please, I'll quickly go for the attendance. Switch on your cameras. Adish Mishra, Athoiba,
Yeah, ma'am.
Ayushi, Sam, Ishita,
Present, ma'am.
Janvi, Kshitij,
Present, ma'am.
Manaswani,
Present, ma'am.
Namrita,
Present, ma'am.
Nandini, Nehal,
Present, ma'am.
Rupal,
Present, ma'am.
Sahiba, Sanjana, Shakti,
Present, ma'am.
Present, ma'am.
Present, ma'am.
Shivani, Tanvi,
Present, ma'am.
Tridiv,
Present,
Vivek,
ma'am. Present, ma'am.
Yuvraj, Yukta.
Present,
Yes.
ma'am.
So Manaswini, just do make a list of those people who have spoken today, right? So that I get to know
Present,
who
ma'am.
all has. Yes. Okay.
Okay, ma'am. I'll
Fine.
do that. I'll
Ma'am
Okay.
send it.
Thank you.
present.